Hello, everyone. If you have ever considered becoming a PACS administrator, maybe you have a technologist background or come from the medical imaging side of things, I have a conversation for you. We're going to talk about what's involved in getting the education required for it, what the job entails, and what options are out there for you for certification. So stick around. Okay, so thank you for joining me. I think I'm just going to dive right in here. If you could just start off by telling us your names and titles and explain a little bit about what you do.
Yeah, I'll kick this off. My name is Jay Crawford, and I'm currently the imaging Chief Imaging Informatics Officer at the University of North Carolina in Chapel Hill, Department of Radiology. I have been around PACS for a long time. I've been in medical imaging for many years, over 30 years. I started as a biomedical engineer and progressed into system administration and PACS administration actually since 1995. So going on 30 years of PACS administration and leadership and change management, all the components of that. So I'm also currently a adjunct professor of health informatics and analytics at Texas Tech University and a trainer for the Society for Imaging Informatics in Medicine, helping new users understand the components and the management of PACS.
Wow, that's a lot of credentials. Before Ally, before you jump on and introduce yourself, I want to mention I lived in North Carolina for a few years, and I had an opportunity to attend a digital radiography educational series for educators before any of that stuff came out in textbooks, put on by Barry Burns, and I believe Andrew Woodward was there.
Yeah, absolutely. I know them
Yeah,
both.
you guys have great facilities out there. Love
Yeah,
it.
thank you.
Yeah, oh, that's so cool. I like that connection there. My name is Ally Brown, and I am the Vice President of Learning at the Society for Imaging Informatics in Medicine. So my background is actually in education, and most of my career worked within the association space in medical education. And so coming to SIIM, it's been really exciting to see that link between technology and education and the medical space. And through working with the individuals like Jay and some of our other trainers and our SIIM members and audience, it's been really interesting to me to see just kind of those behind the scenes things that you don't necessarily know of as a patient, for example. And so one of the things that I really try to do here in my role is to increase the visibility of some of our training programs that Jay mentioned. So we have SIIM training. And so that's really to help to build the foundational knowledge and, to help people upskill in their careers as not just PACS administrators, but imaging informatics professionals.
That's excellent. And there is a huge difference in that terminology. That's something I want to dive into. I think first and foremost, my audience typically is composed of radiography students, but the more I branch out, the more I'm getting, current technologists, educators, sometimes managers in there. But I know when I was dabbling in PACS, there were multiple routes towards getting a job in PACS administration, but this is 10 years ago, maybe. I guess what's the best or we'll say most competent way to dive into a career in PACS administration?
Yeah, I'll talk about this a little bit. There are really still two primary pathways to get into being a PACS administrator, and that is a technologist who has an interest in under the hood and how things work and how do we get the images from point A to B. And the second pathway is a clinical IT specialist who is supporting kind of the back end of things, but wants to know more about the front end and the interaction with the patients and the image acquisition themselves. So we see traditionally that the majority of people who would begin a journey into PACS administration came from technologists. I think that 20 years ago, PACS was very much a radiology centric product. The workflow was all radiology based. And for the most part, the images and the distribution of those images was confined to the radiology department. So it made sense for the tech who understood the acquisition from the CT or the MRI or the digital radiography, was a natural leader to extend that workflow into the digital world. What we're seeing now is much more enterprise-based image distribution and acquisition and storage and all the components of that. So we're seeing, I think, a larger proponent of IT people who are coming from a storage or a server side of things to support enterprise imaging. And most of our training, what we try and do is level the playing field. So often in our course structures, the first couple components, whether it's in a textbook or face-to-face training, is that we provide the technical individuals with a clinical basis and some terminology and understanding of how these modalities work. Conversely, we take the technologist and we provide them with some IT background, a switch versus a router, and what some fundamentals of networking and how bits and bytes get from point A to point B. So we see both, and our attempt is to give a conversational knowledge on the opposite side of the fence so that they can become a fully functional and completely rounded PACS support or imaging informaticist.
So that's great. There's two paths that you spoke about to get into this. One is, just to summarize briefly, an IT professional who wants to get into the medical side of things. The other is for a technologist, a trained medical radiographer, any modality, who has an interest in the subject and can learn those IT skills. Where do you say, would either of those pathways have an advantage over the other?
No, I think that they complement one another. I think that actually a well-rounded team has some individuals from both backgrounds, and they complement each other. It allows the team to learn from one another, but they're no advantage to one or the other, but both are necessary in a good, fully rounded team. Okay.
Knowing my audience is primarily technologist based, I'm going to kind of focus my questions on that going forward. But what kind of skill sets or attributes would allow some success for a smooth transition into this career path?
The most important skill set for a technologist who really wants to get under that is a good understanding of the workflow, regardless of what systems that are in place. Really, this often comes down to workflow. And that's where a technologist is really in a good place, because they understand how an order is created. They may not know how it gets from order entry into the modality work list or something on a scanner, but they understand that workflow. And by taking that basic understanding of the workflow and extending it to the digital component of that, they're really in a good place. In terms of applications, what we often see is the technologist who has an interest in that. Upgrades are a great way for a technologist to really get their feet in deep in something like that. So if you implement a new electronic health record or a new PACS, what we often see is the technologist, it sparks an interest in them. They become the super user. They train their colleagues. And by taking that extra step of really understanding that application, whether it's the configuration or the actual use of that application, they get that spark lit and extend that on to fully supporting that application.
I love that. And that's something I tell my students all the time is any type of additional information or training you can get on site, do it. And that's how opportunities have come to me in the past. Anytime like we started working with an Epic implementation, or maybe we got a new X-ray room when they installed DR, I was the guy that was reading the manual and everybody was kind of giggling, like, why are you doing that? We're going to have applications. And I said, well, applications, they just go through basics. I want to know how to really work this thing.
Exactly.
So I love that. I love that. The initiative spurs on the opportunity, I think.
Absolutely.
So let me maybe I should have asked this question earlier, but can you just walk me through a typical day in the life of a PACS administrator? What do they do?
One of the things that's really fun about a career as a PACS administrator, imaging informaticist, is that no 2 days are quite alike. There are always going to be unexpected situations that arise, some planned, some unplanned. A typical day is a combination of both of those, planned and unplanned events. There are often studies that, for whatever reason, did not make it through the normal imaging pathways. They may be in what's called a failed verification state. So one of the common functions a technologist will do is look for studies that may have a mismatch between a medical record number and a session number, and resolve that mismatch and make sure that those images are available for the radiologist. They work a lot with the techs to make sure that the data is right, make sure the interfaces and the data is all flowing the right way, as well as looking at the displays, making sure that everything is calibrated for a good diagnostic interpretation by the radiologist. Make sure that the ancillary information, whether it's coming from an EHR, whether it's a lab or a prior results, are all available. So it's managing that day-to-day flow, both of demographic information, orders, results, as well as the image information coming from the modality, and make sure that all that flows, comes together in a comprehensive set to present to the radiologist with that ancillary information to ensure that they can make a fast and accurate diagnosis.
That's a lot of hats to wear.
It is.
And I imagine if you've never worked in an advanced modality, maybe your limited knowledge of those modalities might, would it be a hindrance, or do you think it would be easy to learn kind of what you're looking at in order to be able to do your job?
I think that it can be learned. Some things take time to learn, and some just comes with experience. I mean, if a radiologist tells an IT person that the T2 sagittal images on this MR look fuzzy, or something's wrong with them, they may not understand that the first time that question is asked. But I think with knowledge and their colleagues and having the radiologist show them what they're looking at, that type of terminology can become familiar enough that they'll be able to look and solve those problems. So sometimes I've been doing this, as I said, I've been doing this a long time, and I think I learn something every day. So this is a continual learning process.
One of the things I've noticed working in multiple modalities is I feel like, and this could just be my experience, but I feel like radiologists and other imaging professionals, such as PACS administrators, have a little more respect for you and are willing to take time to show you things the more experience you have. Would you say that's true with PACS admin?
Yeah, I think if you could communicate on even if it's fundamental knowledge base, if you can communicate with them and show that desire to learn. I mean, radiologists want to share and impart knowledge. That's part of what they do. Another thing, I think a lot of radiologists are kind of technical basis also. I think that's one of the reasons why some go into the field of radiology, especially of radiology, because they have this interest in kind of the computers and medicine. So you have that kind of link where you start there. So as long as you show an interest, have at least a conversational knowledge of what they're talking about, I think they'll be more than happy to show you because they know that you're there to solve the issue.
That's great to hear. It's very encouraging. I'm going to switch gears a little bit because I always get this question. what kind of a salary does a typical PACS administrator make? And I realize it's going to vary per region, but maybe we could compare it to that of a general X-ray tech.
Yeah, I think that's yeah. Jeremy, you struck the first thing I was going to say. It varies. It varies a lot. One who makes a transition from a technologist into that role is kind of a starting entry. You would see salaries comparable to a seasoned technologist. As one progresses in the career, I don't think that there's probably an upper limit. I don't know what that upper limit is, but there is definitely a career path for expansion in that. One of the things, and Ally may be able to talk about this, is that SIIM does is a periodic salary survey. It's actually going on right now, where what we're trying to do is look at some of those variables in terms of experience and areas of responsibility versus salary, to help individuals understand, where they would fit into that salary range.
You brought up the acronym SIIM. Would you mind going into what that stands for?
Yeah, Ally, do you want to answer that one?
Sure. Yeah. So SIIM is the Society for Imaging Informatics in Medicine, and we are a membership association. We've been around under various names, but for the most part, I think we've been SIIM for, oh my gosh, Jay, do you remember when we started, like 30 years ago, maybe? I think it's
yeah, it was SCAR, the Society for Computer Applications in Radiology, since the late 70s, early 80s. And then in 2006, again, as I mentioned, we went from a radiology-centric application or to an enterprise-wide. So we changed the name in 2006 from Computerized Applications in Radiology to Imaging Informatics in Medicine, to reflect that broader scope of the individual. And that happened in 2006.
And it seems like it just keeps expanding as technology goes on here. I'm sure there's going to be some additional acronyms going forward. Let's talk a little bit. I know there's a couple certifications, one specific to IT and one for the technologist background. But what certification does a technologist need to acquire in order to become a certified PACS administrator?
There are a couple kind of key certification organizations that are going on. There's the American Board of Imaging Informatics provides a certification. It's called the Certified Imaging Informatics Professional. And that's a comprehensive demonstration of a wide range of skills that a fully qualified imaging informaticist would need, from financial analysis to education, as well as the technical and clinical components. On the other side, we have a group called PARCA, and PARCA offers more specialized training, a system administrator specific course, a technologist specific course. So it's more tiered, and then upon successful completion of these baseline courses, one could get a fully qualified system administrator course. So it's that has a couple steps, as well as some specialized in DICOM and HL7, some of the other protocols and things that we use. Well, the CIIP, the certification of the Certified Imaging Informatics Professional, is broad-based, one level from 0 to 100. Basically, you get that and you're fully qualified.
And I know that you guys offer some dedicated education toward these areas. I know you've got some self-study information, as well as some, I don't know if it's online courses or in-person or both. But yeah, I'd love to hear more about what you offer.
Yeah, I can take this one. So across the sim learning landscape, we have a couple of different options, and it really depends on where you are in your career and what your specific needs are. So whether you want to just upskill and get a little bit of professional development, we have webinars that we have usually on a monthly basis. We have different kind of series that are held a couple of different times per year, but typically we have them monthly. We have self-study courses, like you mentioned. So we have some of these like kind of virtual learning modules that are meant to be a little bit more interactive. One of which is actually the IIP Bootcamp. And that is a bootcamp style course that really helps to prepare individuals to take and pass the CIIP exam. And along with that, we also have like a knowledge check that's kind of a supplementary type of module. And that's really meant to be a self-assessment. So you're answering these questions that are kind of modeled on what the CIIP exam looks like. And it really, again, it just prepares you and gets you into that setting there to take and hopefully pass the exam. On the other side of things in sim training, which is a little bit more comprehensive and meant to be really that foundational and comprehensive learning experience for people. We have bootcamp style courses. And so some of those are run in person or virtually, live virtual courses by individuals like Jay. We actually just completed one at SIIM headquarters just 2 weeks ago, which was great, very comprehensive and a fun course, very hands-on as well. So we try to meet learners where they are. We know that we have this kind of, not just within North America, but across the globe, there is that need for that education, standardizing things and just getting, kind of getting the word out there. And so we offer self-study courses. We've got the online e-learning modules. We have recorded webinars, so those, on-demand webinars. We can do face-to-face, we can do live virtual. And no matter what we do, we really try to, again, meet the needs of those learners and give them something that is a takeaway for them. So one of the tools that we use in some of our live training is we have a virtual hospital program, which is really kind of, it's built on open source software. And we have different assignments that we have the students go through, and these are real world examples, case studies, that sort of thing. And so they're going through these assignments, and in this virtual hospital, it's able to really recreate that hands-on environment that they would be working on day to day. So they get that, kind of interactivity that really drives the point home, really drives their learning home, and provides that additional context for them.
That's excellent. So you have like a simulated PACS environment, so students don't have to talk someone at their hospital they work at to give them access to these features.
Yeah, that's really cool that we can simulate making orders, we can make images, we can pump them into a PACS, and as we're doing that, we can also either ingest errors in those systems so that we can then watch a message. Why did it fail? Or, why did that image not go there? So it really follows those pathways that we talked about in terms of both the order and the demographic information as well as the image information. And we can sniff it on the wire between each one of those points. It's a great way to learn without messing around with a live system.
Is there any sort of, once you become CIIP certified, I hope I'm using the right terminology there, are there continuing education requirements to maintain that certification?
Yes, there's annual certificate, number of CE credits that you have to have, as well as a more robust, at least currently, a robust 10-year larger project recertification. So there's continuing education for the first 10 years. And at the 10-year, you have to demonstrate by a process improvement or mentorship or retesting to kind of ensure that your skills are still fully adequate at 10-year mark.
And do you have to have any sort of qualifications to sit for that exam? Like I know for the ART exam, they require a JCERT accredited program. anything like that?
There is a point system that looks at your current credentials, your years of experience in the field, and your education, and you have to have a minimum of 7 points on that against that scale. That's available on the American Board of Imaging Informatics website, ABII.org. So one can self-assess, yeah.
Okay, I can post that link, and I believe I've looked at that before, but I'll post that link under the video here. Just to kind of flip the question a little bit, is there anyone you can think of who should not attempt to go into this field?
That's an interesting question. I can't think. I mean, I think that someone has to have a passion for that convergence of healthcare and technology. And as long as one has that combination, I don't think there's any limitations. If they don't have a passion for healthcare and its relationship to technology, if they're adverse to change.
But yeah, that's great to hear. I think, when I was looking into this for myself, I came from a background of, somebody taught me how to build computers and then how to install the operating systems. And then I eventually got into networking. And I was very fortunate to feel comfortable around a lot of the terminology. But I think for someone looking at this for the first time without that kind of a background, it can be intimidating. You see all these acronyms and you're not quite sure. I don't think most radiography programs don't go too much into PACS or any of the computer side of things. What would you recommend as first steps for anybody considering this who might be feeling a little intimidated?
I want to jump in here before Jay and just mention one of the things that I found in just my work with SIIM and with SIIM training across the past couple of months is that there are so many different avenues by which people come to this profession. And I will say, as an example, like I mentioned, we recently had an on-site training at SIIM headquarters a couple of weeks ago. And one of the interesting things that I found is that all of the students were from different specialties, or they had different, education, or it's just a different avenue by which they had come to this course and were interested in becoming a PACS admin, or again, just really honing their skills and specializing there. And what that allowed us to do in that training was actually allow everybody to learn from and with one another. And so we found that they were having these discussions around, one of the systems analysts said, oh, well, we usually troubleshoot this way. Whereas some, we had two individuals who were they had been working as PACS analysts for a number of years. And they said, okay, well, we would do it this way. And so it's really interesting. And I think that really helps for somebody who is a little bit, having some anxiety around where do I start? Am I the right person for this? Is that there's no right way to do it. It seems like, if you're passionate, if you have the right education and the right motivation to get that education, I think you'll be successful.
You're both so encouraging. I love this. So one thing that just popped in my mind as you were speaking was, the last few years with COVID and with the switch to jobs going remotely. Are you seeing a shift in this field toward more remote jobs, or are people still required as PACS administrator to work out of the hospital, or are there hybrid opportunities?
Yeah, there's certainly hybrid opportunities. We see a lot of shift towards remote or hybrid. There are so many tools now where one can remote desktop or log into workstations or servers and look at logs or look at images and see what's going on. So the need to physically be on site is somewhat reduced. Of course, you're going to have someone on site when a keyboard or a mouse fails, or need to physically look at a monitor or push a button for something. But a vast majority of the service can be done remotely. So we see a lot of hybrid. We see a lot of cases now where if there's a PACS team, they rotate who is on site and who is working remotely. So you can do an awful lot of your job. The other side of that is that we see the radiologist having more and more work since COVID in particular, more and more workstations at home. So they're doing the same thing as we tried to decompress the reading rooms in a period of COVID so that we had more physical space between the individuals, but still had the same number of studies to read. By deploying workstations to their homes, we could do a similar process where we alternated who was in the hospital and who was reading from home. So the work continued to happen. We had that physical separation between the individuals, and it works out great.
That's excellent. It's just I've been a manager for the last 9-10 years now, and the amount of people I see wanting to leave healthcare for a remote opportunity, but still use their skill sets seems to just be growing. And I think COVID has forced us to, show that that's possible. Do you see that growing going forward, or do you see, I guess, maybe any additional opportunities along this line of work?
I think that both from, we've mostly been talking about kind of hospital-based administration, but I would say also from the vendor side who are doing some of the baseline support for some of these PACS and PACS servers, the 100% remote or nearly 100% remote is a really viable option. So that if you're going to support nationwide with a PACS vendor, the vast majority of that work you can do from anywhere at all. So there's opportunities not only with hospitals where you often have that, have to rotate and go in for the physical work that needs to be done, but the vendor component of a PACS administrator, system administrator is typically 100%. I have a colleague who lives in Colorado and works for a healthcare organization in California, not required to move. So we're seeing more and more 100% remote. But I think the hybrid, for healthcare organizations, the hybrid is probably the most common model right now, where you either rotate or come in on a regular schedule. But there are certainly 100% remote, with rare exceptions, but 100% remote opportunities also.
This is why I'm glad I'm speaking to you instead of just doing a summary video about it myself. My mind is so focused on hospital and has been for so long. It's great to know the options there. What additional career pathways might someone have available, or I guess additional areas to expand into once you're actually working as a PACS administrator?
This is a great time to be a PACS administrator. And as a matter of fact, that term is kind of being phased out for this imaging informatics, because as we mentioned, as PACS or this image management goes from a radiology-centric focus to this enterprise focus, there are a lot of people in a healthcare organization that make pictures besides radiologists. So we're extending this model that we've used for 30 years of radiology-based PACS into these other specialties. So the expertise that we've learned in radiology, that one has that expertise in radiology, they can extend this easily to the entire enterprise. So cardiology and dermatology and pathology, which is an exciting new specialty that's really getting into digital imaging. So one can grow from departmental focus into a hospital-based focus and really extend their scope of, they become the healthcare organization specialist in image and image management and image data and image retention and all those things. So the opportunity to come from a departmental focus to either a hospital-focused or conceivably a system-wide, multiple hospital focus as an imaging expert, regardless of the specialty involved, it's just a wealth of opportunities.
And that is something I've seen in the educational field. You're starting to see, I've only looked at master's programs, so I don't know if there's bachelor's, but the imaging informatics as a major Are you familiar with any programs either at the undergrad or graduate level that would encompass everything that you're getting out of the information that compared to the information that you offer through SIIM? Or is there a preference, have you seen, in the job market between an educational degree versus the highly focused training that you're offering?
I can't speak for Ally, but I don't see a lot of that level of specification in undergraduate world. Because of some of those kind of experiential experience that one has to have before they really get into the imaging informatics. I don't know if that makes a lot of sense at the undergraduate level. Like in a technologist program, there will be courses, certainly, or a course in imaging informatics to expose them to that, but it won't be their primary focus. Because if you're talking about coming from a tech, you really need that understanding of the workflow and experience before you really dive into that. Plus, it gives you a chance to dip your toes in it and see if it's something you really want to do. So at the graduate level, there are programs and focuses on informatics in general. As I mentioned earlier, I teach health informatics, but there's certainly a large component of that that's imaging informatics at a master's level. I think, and Ally can talk to this a little bit more, but I think as one becomes interested in becoming an imaging informaticist, it's often the training like SIIM provides that really provide the best basis for helping them make a faster transition into that field.
That's great to know. Ally, do you have any additional comments on that? I see you shaking your head.
Yeah, just that I concur with Jay.
Okay. Normally, I would come to an interview like this prepared with Bureau of Labor Statistics information, but I did not do that today. Can you speak to the current job outlook and where it may be going, we'll say, in the next 10 years?
I can kind of start off with this. I mean, one of the things Jay mentioned is that SIIM does a periodic salary survey. And so those are some of the insights that we kind of look into. And now I can't speak to what the most recent one that we did in 2020 looked like, because I'm actually relatively new to SIIM. But, we'll have those insights for 2023 released obviously later this year. But again, it seems like one of those fields that is continually growing as technology evolves. And then we have this notion of enterprise imaging that Jay kind of touched on a little bit, which is, who owns the images and what are the different systems by which we can use these images, store them, and not just specialize in radiology, but cardiology, pathology, dermatology, all the ologies almost. So yeah, I would say that there's a huge outlook, especially as we approach our 10 years of enterprise imaging in 2024. It's just going to move forward from here.
That's great to hear. So in wrapping up, I guess, where should people go to learn more about these options as a career choice? Where can you point them to?
I would definitely say SIIM is the place to go. One of the really great things about SIIM right now, as well, is that we are currently working on what we're calling our digital transformation. And we're rolling out a new website, database, and learning management system all in one within the next month. And what that is meant to do is provide these different pathways for whatever avenue you're coming to SIIM as. So if you're a clinician, here's the journey for you. What makes the most sense for you in terms of learning and resources and events? If you are a vendor, same questions for you. What is your journey to being an imaging informatics professional look like, or catering to imaging informatics professionals? We just have such a wealth of knowledge and resources there already, and it'll be just, an easier and better curiosity portal once that launches. And then, of course, I have to plug SIIM training. I think has some great resources. Again, we have self-study courses. We have premier instructors who have been in the field for such a long time and just know they just have such a wealth of knowledge. And yes, I am talking about Jay. Just such a wealth of knowledge, and it's so encouraging to be around these well-seasoned professionals where you can ask them any off-the-wall question and they just know. So yeah, we've got access to a lot of great resources over here at SIIM.
That's for sure. And one thing that SIIM has done that I really like is that they have created personas. And the personas, is as Ellie touched about, we've talked about in the course of this conversation that there are technologists and there are IT professionals and vendors and data scientists as we start talking about artificial intelligence and imaging and some other things that have an interest in knowing more about the clinical side of things. So created these personas so that each individual, no matter where their starting point is, has a pathway into and a growth pattern within SIIM. I would say there's 3 resources that if I wanted to learn more and was just interested in this field, as Ali mentioned, SIIM, SIIM.org, and look in their education training tabs, a ton of information there, and you can get all your CE credits, and those credits are applicable to techs as well as they are to imaging informaticists. For the kind of CIIP, that Certified Imaging Informatics Professional, the American Board of Imaging Informatics is the overseer of that certification. So they have some of the test questions, some of those requirements that we talked about, as well as a test content outline, which discusses the 10 domains of knowledge domains that one would have to have an understanding of to be certified, and some examples within there. So that's a really good resource. And the third resource is there's a relatively recent second edition of a Practical Imaging Informatics textbook, and that Practical Imaging Informatics, and edited by Brandstetter, and that book is a very comprehensive, very detailed wealth of knowledge across the wide spectrum of imaging informatics. But by looking at those 2 websites, as well as flipping through that textbook, I think one really gets a good concept of what this field is all about.
That's excellent. I actually have a copy of that book. It's very expansive. It's a lot of info, but excellent information. I just want to say thank you for your time. I feel much better informed myself. You've been educational and entertaining. I really appreciate it. I will put all of these links that you're mentioning down in the section below the video for people to click on. And thank you so much for your time, for being willing to just get out there and be open about this info.
Thank you.
Yeah, thanks for having us.